My name is Stefano Nominari. I'm Associate Professor of Medical Oncology, and I currently work in the Hematology Division of the Reggio Emilia Hospital in Italy. Okay, marginal zone lymphoma is not the most frequent subtype of lymphomas, but and as expected, we don't have many contribution in the field, also because this is a quite recent subtypes that is recently acknowledged as an important subtype for clinical research, but actually we have some good contribution. The most important one is a phase 2 study that was presented by Dr. Goy from the Memorial Sloan Kettering Cancer Center in New York, investigating the role of ibrutinib, a BTK inhibitor, for the treatment of relapsed refractory patients with marginal zone lymphomas. The study enrolled 63 patients. The patients were of all subtypes, including splenic, nodal, and extranodal origin. And among these 63 patients, all the patients were treated with a standard dose of 560 milligrams of ibrutinib. And the results were shown and were very interesting because tumor shrinkage was observed in 80% of the patients. That means a significant improvement in the clinical condition of the patient. The overall response rate was 48%, and the median PFS reached with single agent treatment, no chemotherapy, was 14.2 months. The safety profile of the drug was excellent, with most of the events of grade 1 and 2, and with 8% of pneumonia cases observed. Most of the cases were manageable, and the toxicity profile was that expected for the drug ibrutinib used in other indications. So this is a very important trial because this is the first trial, the largest trial that investigates the role of BTK inhibition in this setting, confirms that BTK is a crucial role in the development and in sustaining the disease in marginal zone lymphomas. And these results are so promising and so important that I think that it can be considered an important study to define a new option, if not a new standard, for this patient population in the relapsed refractory setting. There are some other contribution during this meeting for the treatment of marginal zone lymphoma. They include mainly the chemo-free regimens, R-square regimen, that is the combination of lenalidomide and rituximab, has been tested in the Magnify trial. That it was a trial investigating induction and maintenance with R-square, not only in marginal zone lymphomas, but in other indolent subtypes, including follicular and mantle cell lymphoma. The data were presented in poster, and the activity of the combination in this setting of marginal zone patient with the combination was actually confirmed. We are now looking forward for the data, prolonged data of maintenance. But with this contribution, the activity of R-square regimen is confirmed also in marginal zone lymphomas. So another important contribution comes from the Gallium study, that investigating in a randomized fashion the role of blinatumomab plus chemotherapy compared with rituximab plus chemotherapy in a large population of indolent lymphoma patients. Actually, the data were disclosed only for the follicular subset of the patient. That was the main subset of patients included in this trial, and showed positive results in terms of progression-free survival. And but this study also included 195 patients with marginal zone subtypes. This data were not presented at this meeting, but will be presented in the next upcoming meeting. I think that we should look forward to looking at this important subset of the Gallium study to realize if the new monoclonal antibody anti-CD20 obinutuzumab may further improve the management of our patient with marginal zone lymphoma.